Good morning, my name is Natasha and I'm the Senior Programme Manager for the UK Health Show. I'm here this morning at the NHS Improvement Offices with Adam Sewell-Jones, who's the Executive Director of Improvement. Thank you for joining us this morning, Adam.
Pleasure.
We're just here to have a quick catch up. Adam's going to be speaking at the show, talking about the Virginia Mason partnership. So Adam, if we could just start off by telling me a little bit more about the partnership. So what actually prompted the partnership with the Virginia Mason Institute?
Well, really a lot of credit goes back to our recently departed Secretary of State, who I think went to the US and visited Virginia Mason, and with his personal drive to improve patient safety saw an organisation that had really made strides in this. So came back and encouraged us to develop a programme. We looked for a partner, and Virginia Mason won through the procurement process.
Oh, great.
And that's really the kind of start to create organisations that became leading lights in patient safety.
Oh, brilliant. So the programme's now been running for the past 3 years. Without giving too much away, what have some of the biggest achievements been over the course of time?
In many respects it's quite difficult, because one of the principles of this work, Virginia Mason talk about inch wide, mile deep.
Okay.
And so a lot of the challenges in a world where we want rapid delivery, actually to get real change you have to kind of focus on quite small areas and really embed them. But what's fascinating when you go to the Trust, you just hear some quite profound changes, but in a small area. So some of the trusts have made financial savings, not the reason for the activity, but £500,000 has been saved in 1 week's activity around orthopaedic prosthesis. Other areas you see people waiting times for procedures going down from weeks to days. And one interesting one, particularly around patient safety at Coventry, the process when there is a patient safety incident would often take days to really get evaluated and decided how serious it was, and now in a matter of minutes they've changed their processes. So in areas where they've done the work, some profound changes, and we're just starting to see at quite a big level now some of the organisations reporting big improvements in staff engagement, financial performance, and a number of other of the key measures.
Wow, that's pretty incredible to go from days to minutes. That's
it's
not an easy feat.
No, it's stunning really. And another feature of the programme is hearing relatively junior staff who traditionally wouldn't have been involved in problem solving in this way, being able to get involved and reporting back how they've changed their bit of the process, and it has a profound impact not just on patients actually, but on staff. Some of the measures about the number of steps from A to B in a process and redesigning the layouts, when you realise staff are doing that time and time again every day, has an impact on the value that they feel they're giving, because no one wants to be spending their day walking around. You want to be actually giving care to patients.
No, absolutely. So you'll be participating in a panel discussion as part of our Partnerships and Integration Theatre about obviously the ongoing work that you're doing. What's the one message you would like visitors to take away from that session?
Narrowing it down to one is really hard. Probably the fact that this is a real commitment to changing the way you lead an organisation. And that the chief executives we work with have really described having to relearn how to lead, because traditionally people rise to the top because they're the best problem solvers. So your career is based on how good you are at solving problems. But this work really encourages leaders to frame problems, and the best people to solve them are the people who are delivering the care at the front line. So it's a fundamental shift, but as a result of that it doesn't happen overnight, because it's genuine culture change. As I mentioned earlier on, you don't get those results immediately in all areas, so you need to stick at it and grasp. So it's the kind of hard work nature of a shift in mindset, not just learning a new set of tools that some people look at lean based improvement as a toolkit. This is a culture change programme really.
Okay, brilliant. So what's next for the partnership then? Is there scope for this to be then rolled out to other trusts?
Yeah, massive scope. We shouldn't forget the fact that these trusts are kind of 2.5 years into this programme now, of a 5-year programme. So at one level they're still really toddler steps in learning this process. And there's a danger that people say, well, can we roll that out, can we build it? So I think the trusts are really focusing on making sure they've embedded this across all of their thousands of staff. But what we've done at NHS Improvement is taken the learning and we've set up our own programme now. So we've just launched with 7 new trusts,
Oh, wow.
not in partnership with Virginia Mason, but as I say, taking a lot of that learning, but creating our own expert lean improvement team in this organisation, but taking the principles of working with a group of trusts where they learn from each other. We bring the chief executives together each month to challenge them, to coach them, and to hear, allow them to work with each other. So that's the process. So we're now taking on another 7 trusts, but the demand is really strong.
I can imagine.
So we're now looking at when could we launch another cohort, and it
goodness.
feels like there's some real energy around this work, in part because people are looking at the trusts in our cohort saying, we want to do some of that.
Yeah.
So the opportunity is massive, but we must also kind of take our own medicine and inch wide, mile deep,
Yes.
and not rush to roll this out immediately, and make sure we're embedding it as we go, and making it a really strong, sustainable model.
Perfect. So, in the year that the NHS has turned 70, what would you then say the NHS needs to do to make sure that it continues to deliver the best possible care for the next 70 plus years?
Yeah. So the underpinning principle with this work is continuous improvement, and that's what we have to do. The pressure the NHS is under at the moment is almost totally because we're a victim of our own success.
Yeah,
because as care gets better, people live longer and demand more care.
Absolutely.
So we have to rise to meet that challenge when we know the finances are tight, and that won't change overnight. So we need to constantly be looking at waste within our work, and when we talk about waste in this work, we mean anything that doesn't add value to patients. So the more we can increase the value and reduce the waste, the more, even within the resource constraints that we have, whether that's people, money, or buildings, we can just constantly get better.
Sure.
So I think the NHS we know is loved,
Yeah, absolutely.
but in the same way that you love everyone in your family, you don't necessarily think they're perfect.
Yeah.
And so we have to constantly go and improving, because the people who work in the NHS are driven by wanting to provide value for patients. So it just feels like a really good way of, as an NHS, continuing to get better, and in 70 years' time, looking back and saying, how much we've improved over that period.
No, absolutely. Thank you very much. So my final question, maybe a big question, what are you most looking forward to at the show this year?
Well, interestingly, a big part of the role of NHS Improvement is to not create new things, but just be connecting people in with what's good. And I have a bit of a personal passion in that the NHS is recognised in many studies as the best healthcare system in the world.
Yeah, absolutely.
And yet we constantly think we have to look overseas, as we've done a bit with this work, to find out where good stuff is happening. At an event like this, we are going to see good stuff throughout the whole time of the show, and therefore it's important and really exciting when you can go and see those things in practice, go back to your own organisations, go and tell other people about them. So I think just the sharing of kind of good practice and that ability to spread it to others.
Great. Well, thank you very much for your time this early July morning, Adam. Make sure you join us for the UK Health Show on the 25th and 26th of September, and don't forget to have a look at our website ukhhealthshow.com and follow us on Twitter @UK Health Show, and don't forget the hashtag UKHealthShow18.